you have any questions, as long as we have time, I'd be happy to take them now. Otherwise, thank you all very much for your time, and I wish you a wonderful day. This is me opening up the floor.
Hi, folks. We have a number of questions in the chat. Mike, I'm not sure if any of these are ones that you can answer or if these are more on the program and data side. I think there's a combination of both.
Okay. Sure. I guess I'll boot up my screen share again. So, let's go through these one by one. Medical care source. If they have not a source, but we assisted them, are you going to have that section from no to yes, as we did for the WWV? It helps to know if the staff assisted. I don't know what the WWV is. I work on the tech side.
It's well woman visit.
Okay, got it. Thank you.
Because we made the change to reflect that for the well woman visit, but it wasn't done for the medical source.
Okay, I'm not actually super sure on that off the top of my head.
The medical source is right here.
Yeah. Like about your question about having that section go from no to yes.
Because well, every time we look, we're like, oh, they don't have the medical source, and we have to go and read into the documents to make sure that the worker provided that. So we're not able, just like the well woman visit, we want to see that they were assisted and, you know, that they had the birth plan done and breastfeeding education. We don't get that with the medical source.
Sure.
So that would be great for us to do that.
That sounds like a feature request, and it sounds like a great idea. I don't usually decide the priority lists of, what gets put into the thing but that sounds like a good idea to me, and I wouldn't be surprised if it happens.
Great, thank you.
Referrals tab, isn't that where it also documents pre-registration referrals? What about under the event page? A client needs a quick referral at an event and does not want to enroll in the program. How is that captured in the data? That is a tough question because it's not really something that comes up very often. So basically the idea is you have an outreach event and there's a referral that is being filled out for them. Should be the referral section right here. I don't think we currently have any way to directly link this to a specific new client, because the workflow, as far as like on the technical side of going from this to creating a new client, is a mess, to say the least, especially if you're working with multiple clients at the same time. So in this case, that would all be captured in a separate section for event referrals. And you would need to refer back to this if they ever enrolled, to indicate, who this is. Because one of the big things about like enrolling is that it requires a decent amount of data. And that's data that you're not usually going to have access to at an outreach event. So for now, I can only really say it is stored in the data, it is captured, but it is not linked to the client specifically. And I don't think it's particularly feasible for that to happen in the future, I believe.
Mike, the way you're trying to phrase the question is that sometimes when you even do you have the client coming in Under the initial contact, right? You could go out of and you don't complete the screening form right away. You could go to the referrals tab and enter like, and give them
Oh.
referral, like that's pre-registration. That's what the data is covered, like, captures for pre-registration, pre-enrollment. But I'm talking about also like under the events page, is like, is that captured in the data as well? For clients that are not enrolled in the program, that just want a quick referral, like say we encounter someone, they just want childcare and they don't want to fully enroll into our program. Will we give them a referral to a childcare facility?
So you're essentially asking if the events referrals show up in the report data,
Mm-hmm.
basically.
Yes.
I can check that real quick, I believe. You might need to wait for an answer afterwards, depending on how we're doing on time. But I will definitely check up on that and let you know.
Mm-hmm.
We capture the data. I don't know if we're referring the data. I believe we do off the top of my head, but more often than not, most of the reports are going off of enrolled clients. So I'll let you know.
Okay.
You did not use the
Trying to get
encounter
off this pitch.
section.
Okay, let them know. Okay.
If you did not use the encounter section for documentation and you used case notes instead, what needs to be done now? I don't know what you're specifically referring to in regards to that.
Hi, it's
Uh,
me. I asked that question. I've been using case notes. So the one right after, so the second one down, contact
Mhm.
after, yeah. And documenting on there, not using the encounter section. That was wrong, obviously. So do I need to go back and do all of my encounters into the encounter section?
If you want them to be recorded on the reports, I would say that's probably a good idea.
Okay.
Case notes are always going to be there, but we don't really have a way to screen for like specific keywords and that sort of thing when you're scanning through the data.
Oh.
So yeah.
Okay, thank you.
Yep. For postpartum question 25, is there another way we can update yes, appointment made, and we approve to attend appointment without having to approve the form and then disapprove?
Like when they're born, when we first have the clients, they're born, and then we fill out this child form. And then it's February. So we're saying, yes, I mean, this is the wrong one. There's an has already attended, yeah. So we put yes, that the postpartum was scheduled, but then we have to unapprove it to add in when they do schedule the appointment. So is there any way, because we usually either leave it open until that appointment is done so we can get credit for the attendant? Or do you want us to approve it? Like there should be an additional step there. Because we either have to approve it, then unapprove it and change it.
I don't think there's really a way around that right now, because whenever you're approving it, you are basically saying, yes, I acknowledge and I'm enshrining the sanctity of this data. Like this is definitely right now.
But the thing is, when we close it, when we prove it, sometimes, we have 250 cases. So
Yes.
we're looking at it, if we approve it, then a supervisor might forget to go back into it, even if the appointment was made, to update it. So you can miss it sometimes. So we have to be extra diligent and looking at every case to make sure, the new ones that gave birth, to make sure that this is done. But sometimes like we looked and we're like, oh, how did we miss this? It's been updated. So
Sure.
there has to be either we keep it unapproved and you're not going to get that information until we have it attended. And then afterwards, if they just scheduled it and they missed the appointment, it's going to be a yes. So
there is I would call it a workaround for this, I think. I'm going to go in as a data entry and look at one of our existing workers. What form is this on again?
It's in the children and pregnancy form.
Got it. So obviously, if you're approved, you can't edit anymore. However, supervisors do also have all the permissions of regular workers. So what you can do
Right.
is you can unapprove, go back in, edit
I
it yourself.
understand that, but if you have 70 births, okay, and when we look at the approval section of the form, we're waiting to say, oh, these are the ones that the workers need us to look at and approve, and we look through it. We're not gonna know if it's approved, we're gonna assume that it's done. So it's just to make sure that we're updating the data as much as possible, because we might miss it because we think it's done because we approved it already. Because approval, we're like, we don't need to go check that form anymore because it's done. But that's not the case for this one. We do have to go back, unapprove it when the postpartum is attended. So that's not good. That's not good for supervision. There has to be another way to update that, even if we approved it, or change the question completely.
Isn't that question though reflected in the encounter when you put that the mother attended a postpartum visit?
Exactly, yeah, that's what I was gonna say.
Right, but it won't change that. It won't go and change.
But yeah, but if she had a visit already scheduled, like in the children's and infants, you have to say yes, and then you go into the encounter because you're seeing the patient anyway.
But you got 200 encounters. You're expecting us to go back to do 200 encounters.
But you're
And
having an encounter already on that thing, so you technically do have to fill out both forms, the children's
Right.
because you had an
So-
encounter, and then on the encounter, you write the date for the prenatal visit when it was scheduled.
Right, so if they didn't attend, right, and they don't want to attend, that's the problem. So if they
But,
don't
like-
attend and they didn't attend, then the worker has to, or is it, say it's 5 weeks and she misses her appointment. We really need to focus on making sure that she attends that appointment. Like the window of, just because we recorded that she has an appointment. Don't
I
you
mean,
know how many people has already attended?
So I don't-
Why is the question?
Yeah, no, so I don't think it should be put in like, the children's in it. I think it should be put in the encounter form, whereas like, that she has an appointment scheduled and it's like a reminder, like the CHOs do get the reminder of that they have to complete an encounter monthly. Like something to pop out, like this date is coming up. The same way you have like the births like coming up, like, scheduled. Maybe something under
That
that
would be
because.
good. That'd be good.
Because under like a postpartum visit schedule under the children's and infants, I think that's like, yes, like automatically should just put it in, and that's it with that form.
Right.
so one of the things with that is that because none of the forms themselves are linked to a specific child, because you can have, a bunch of children on any given client. We don't really have a way for them to trace back which child that's referring to. I will say though that the postpartum visit schedules, it's more meant to be a snapshot in time. I don't think it's really intended for you to go back to this form once they've done that, click has already attended.
But then
It's
that
more
means we
for-
always would wait 6 weeks for that question. That means that question would never be answered, has already attended. So.
Well, it's
I
it's
have-
like
I
But
mean,
it would be answered depending on their life course when you
Right,
take
but
them in.
if we're doing mostly pregnant women who deliver at the program, because most of your clients have to be pregnant, why would you need that question if you don't want it captured? So that's my point. It's like,
No,
I'm
yeah, I understand
the
your
best
point, and
that
I
I-
agree with you,
Yeah.
but I think it's supposed to be in the encounter form, like, the ways, like if the client is pregnant at her due date and it tells the CHW when is the birth attending. I think
I
that'll be
like that. That'll be
Yeah,
great.
like it'll give a pop out, like, to a reminder that she has to, because postpartum, like a visit is a very important visit, especially at the birth.
Right,
That's one of the key goals of the program.
exactly. You're right.
So this has gone outside the realm of what I am able to answer. I'm just the tech monkey. I just make the questions, or like I just put the questions on the site.
Okay,
So I apologize for an unsatisfactory answer, but I don't think I can help anymore. So if a client is closed and discharged her and you find her 6 months later, do not create a new case. You do not have to create a new case in that instance. You can get your program manager or one of your data entry staff, if you have any, to delete the discharge form. Usually, I still recommend copying it over into an update form, like
Okay.
transferring that.
and how about
And-
if you did then? If
I'm
you,
sorry?
how about if you did that? If you closed the case and then you found her 6 months later and then we opened a brand new case for her, what do we do in that situation? Do you want us to combine both of them together?
Well,
Because that was never told to us.
I'm
so-
going to refer this to the DOH because that's a policy question, and
Okay,
I'm saying what's possible within the system.
okay, that's good to know. And I have to leave soon. I just have one more question.
Of course,
I'm sorry for, I'm just trying to.
you're
get-
good. Don't worry about it.
For when we do approvals, is there any way that we can, most of the stuff that you have date sensitive, like when we do the reporting, we'll do a date from January 1st to January 30th. Is there any way that we can do that for the approval section? Because when we're looking at, all the encounters, there could be 30 counters for a worker, and we're doing supervision. We want to do February's because it's due on March 15th, but we're really looking at approving February stuff. Is there any way that we can separate that so we can just, instead of clicking every single one, can we just do, can we at least look from February 1st, from February 30th? All we want to look is what needs to be approved for that month.
Okay, so
So if we look at, I'm in, the dashboard for approvals.
mhm.
And
Well, I
then
mean, the data here is
going-
going to be messed
Okay,
up because
Okay,
it's
so I have the worker, I'm doing supervision, sorry, and then there's approvals, there's 2 approvals. I select these 2. Is there any way that I only want the February ones? If we can have a date, so we can say, I want what's due to approve in February there. So that way we don't have, we could end up having, 35 for one worker. And
sure.
15 are in February and 20 are in March, and I'm not doing March yet, I'm doing February.
So this is definitely a feature request.
Okay.
However, I do need a little bit of clarification because
Okay.
y'all are boots on the ground. I don't
Okay.
really understand what
So
indicates when a approval is due.
Okay, so I'm doing, on March 15th, data is due. So I'm checking, and data's due on March 15th for the month of February. So I'm going through all the approvals in February, with the staff and doing supervision, but they're also already putting encounters in for March because they're still doing work. So it makes it difficult when I look at the approvals, I'm clicking on each one that needs to be approved, and it might be a March encounter. I don't want to look at the March encounter because I'm trying to approve the February encounter right now.
So you're
It may
basically
be-
asking for a way to sort this based on when the form date of the form that you need to approve was, right?
was due. So
Yeah.
I'm like us, it's simple as February 1st to February 30th. I want to know who is there. And then I'm checking up also on how many home visits that the worker's done in the month. and or for the week to see if they're on track. So March 1st to March 7th, they have no encounters. So then I can go, okay, what's going on? You haven't done a home visit and stuff like that. It would help us to monitor the staff and, you know, catch something sooner instead of waiting and staying till midnight trying to do paperwork on March 15th. So that would be helpful.
That, I mean, it would be definitely possible. I'm not committing to anything right now because
Okay.
the DOH does decide, you know,
Okay.
what I work on when.
Okay.
But I don't see why that wouldn't be possible.
I thank you. I have to go on another call, but I appreciate and look forward to continue to work with you.
No problem. Good luck. Okay, other stuff. So there's requests for a report overview. So I don't have anything prepared for this right now. I've spent a couple weeks working on the stuff that we've covered. You know, I've got a big script for that, but I don't have anything off the top of my head for a report thing. What I will say is, we do provide generally pretty in-depth documentation for every report, which covers what questions this is coming from, what the clients usually, or like what the case base usually is, includes clients active within the specified date range, generally means that their enrollment dates is before the end date of the range you're looking at. And the discharge date, if they have a discharge date, is after the start of what you're looking at. So if they were active anytime in that window, and then it's checking, you know, it's checking has health insurance for if they're uninsured. You know, I'm not saying it's perfect by any means, and by all means, please feel free to contact me. But this is generally our best available resource for figuring out how any individual report works. It'll usually say if it's from the screening form, screening assessment, if it's from the encounter form, so on and so forth. So for more specifics, I would need more specific questions, but generally speaking, the reports are run for one program at a time. You do the start date to end dates for whatever research or for whatever window that you need. That's more DOH knows how they usually run that, but I think it's generally run for more yearly things.
I have a specific question.
Of course.
For instance, when I run completed screenings, the percentage of screenings that come up is, I would expect it to be not 100%. It would be very close to 100%, but it's not. And when I go back into each individual file to see, well, maybe somebody missed one of these sections in a screening, I don't see anything missed. Because when you have an intake and you do that first initial assessment, our community health workers know you complete every single screening. You don't come back later. In that sitting, you're going to answer every single question in that screening, and the supervisor reviews the screenings and they're complete. But when I run the analysis, it's never 100%. So that's where I'm confused. One area, there's others, but that's one thing specific.
Let's see. So, I mean, it does seem like I'm assuming that all of these are filled out in their completion because that is a requirement for it. But I would need to check up on how this goes. But I believe it's screenings completed within the specified date range.
Yeah, so if you did 10 new cases, and if it's just looking at those 10 new cases, and you know you've answered all the questions, but when you run the report, it's not saying that it's 100% complete. And I'm trying to figure out, well, what is missing, what got left out, and I can't find it.
Submit this to me as a ticket. I'll take a look.
Okay,
Okay, anything else? How often do we have to do a client update? It looks like we have to do an update every so many months, even if nothing has changed with the client. I believe that that's generally standard, but that's another policy question. Perhaps our DOH members can clarify on that front.
Hi, this is Ronka. I just want to add that the update form is due every 6 months, or whenever there's update with the client status. For example, the client's pregnant again, things like that.
So even if nothing has changed with the client, like 6 months, everything is still status quo, we still have to do an update?
Yes.
So part of that is, well, I take it back. It's not actually very helpful to go into the technicals. I guess that's just the way it is. Okay, does anyone else have any specific questions that they would like to ask while I am here? I think I got through everyone. If I missed one, that's my bad 100%. But I think I got one. Well, all right then.
I
Thank
just
you
want to
all.
thank everyone for attending and staying on for those of you that were able to. We have documented all the questions that came in through chat, and we will be, for those that are on the DOH side, we will be looking through them and providing a response in the coming. I'm not going to put a time frame on it, but hopefully sooner rather than later. If you do have additional questions that you think of, please send them to the pitch mailbox, pitch@health.ny.gov, and we'll add those to the list. Again, thank you very much, and thank you especially to Mike, and I hope everyone has a good afternoon.
Thank you all for coming out. Have a good one.